Senator Fawcett.
Thank you, Madam Acting Deputy President. I rise to address this matter of public importance on Labor's waste and mismanagement, the chaos caused in the health sector, especially through retrospective funding cuts. I'd just like to firstly rebut a couple of the comments that many of the government members have made. They have been trying desperately to paint the Howard government as a government that didn't care about health and didn't fund it. Well, it's interesting that the Museum of Australian Democracy has fact sheets on different Prime Ministers where they highlight just half a dozen of their key achievements. And guess what one of those half dozen key achievements for Prime Minister John Winston Howard AC was? Record health funding of $47.6 billion in 06-07. And just in case you think this might be some kind of conservative think tank, there are 4 ex-members of parliament on their advisory council, 2 of whom are Labor, 1 of whom is a Democrat, and only 1 Liberal, so hardly a partisan body that would be favouring the Conservative Party. But they put that down as one of the key achievements of the Howard government, record health funding. Now, the government members have been saying today, particularly during question time and during this MPI, who us? Would we cut health funding? Never. But if you look at the analysis of the health provisions in the 2012-13 MyEFO, conducted not by the Liberal Party but by the Australian Primary Healthcare Research Institute at the Australian National University, in their introduction they bell the cat on this. They say the hidden disaster in the 2012-13 MyEFO is the hit, brackets, unacknowledged by anyone in the government, end brackets, taken by preventative and public health. We know that $1.5 billion over 4 years has been cut from the National Health Reform funding. So don't come and talk to the coalition and say we're saying things that are unfounded. Go and look at independent experts who've studied this in detail and look at their pronouncements, and they have indicated that the government has made these cuts. Now, this matter of public importance that was raised by Senator Fiervanti-Wells talks about waste, mismanagement and chaos. In South Australia, we know too well about Labor waste in the health area. GP super clinics, 64 of them promised at the cost of $650 million around the country. In Modbury in South Australia, clinic opens right next door to areas where it's well served by existing private practices. No GPs. President of the AMA, Stephen Hamilton, hit the nail on the head when he said this is a big waste of government money. Mismanagement. People in South Australia, particularly in rural areas, only know too well. When Ms Roxon in 2009 got rid of the rural and remote metro area way of allocating funding and brought in the Australian Standard Geographical Classification, that saw places like Hobart considered more rural and remote than parts of South Australia, and large parts of our population lost out on funding to provide accident, emergency and after-hours health. In terms of chaos, which is the point of this MPI, retrospective funding cuts hurt. Now, we see in Victoria that the state Liberal government there has taken this government to task and challenged them about their $107 million. Well, the problem for people in South Australia is we get a double hit of Labor's waste, mismanagement and chaos, because not only is there a federal government who has cut funding to the tune of $31 million from South Australia's health budget, we have a Premier, and Mr Weatherall in South Australia, who does not stand up for the state. In fact, when questioned in state parliament about this, rather than say, oh, you're right, perhaps I should go and challenge the federal government, he tried to indicate that perhaps the Victorians weren't actually doing what everyone knew they were doing. Now that New South Wales and Queensland are also challenging, he still hasn't taken his federal counterparts to task. And so Mr Weatherall must step up to the plate and fight for South Australia to reclaim that $31 million as opposed to just rolling over, because the consequences for the South Australian public are extreme. The long-promised outpatient facility at Lower McEwen Hospital has been scrapped to save money. There's other delays at Modbury. At Flinders, there are still people, 6 ambulances left waiting on a ramp just last week on a day when temperatures peaked at 40 degrees. The health outcomes for the people in South Australia are suffering as a result of Labor waste, mismanagement and chaos, and they get a double hit, because it's not only from this Gillard government that, as I've just shown, independent external commentators are highlighting the cuts to the health budget, but the state premier, the Labor state premier, Mr Weatherall, is not fighting for the people of South Australia.
Thank you, Senator Fawcett. Senator